show everybody here. There is our team today. We're back here, Karen Lynch, Karen Whitney, Hope Mers, and myself. And thanks for coming back. Today, what we thought we would do is answer some questions that have been coming in throughout the week. And Karen Lynch has compiled a list of some common questions and questions that you all have had. And so we're going to cover a lot of different topics. At the end, we've also had some questions about the virtual consultations and how we go about those. Typically what we're doing is we're using either FaceTime if you're an Apple user, or Zoom as we're doing here. And we'll send you an invitation. Generally, you'll meet with me directly and only. It's about a 30-minute to 40-minute appointment. When you come into the office, generally you're meeting with Hope and Karen and the rest of our team as well as myself. But we can do a pretty good job if we understand what your needs are, and we're happy to do so while we're on this coronavirus stay. Hope everybody is healthy and doing well. But I think what we'll do is we're going to turn it over to Karen here, and we're going to start with our first questions.
This first question I think should be for Hope, but we got a question that says, I have brown spots all over my face and creams aren't helping. Is there a laser I could do without having any downtime?
Yes, actually there's a good option for that. So when we think about how we're going to treat brown spots, we want to know what type of brown spot we're dealing with. Is it, bumped up? Is it flat? Is it underneath the skin? Is it deep? So those things we can kind of see when we're looking at you in person. But also we want to consider your skin type, so your skin coloration and your ability to produce melanin versus someone like me who's very fair. And, even if I did go in the sun for a long time, I'm more likely to burn just because I don't have as much ability to produce melanin, which is our pigmentation in our skin, as someone with a darker skin tone. So, with this laser that I'm thinking of called PicoSure Focus Array, it's a very safe laser for multiple different skin tones because it uses a mechanical mechanism to break up pigmentation. So it pulses so quickly that it breaks up the pigment mechanically. I kind of compare this, and I think, Karen, you have a comparison as well, but I say dropping a glass on the floor. So your glass is going to shatter, right? So that's kind of what it's doing to these pigmentation cells in the skin, as opposed to a laser that uses heat, direct heat, to break up pigmentation. So a laser that uses heat typically comes with a little bit more downtime. It also typically, it can produce a type of post-inflammatory hyperpigmentation where our melanocytes, when we produce melanin, it kind of hyperstimulates that. So there's a risk of that with darker skin tones, people that can produce more melanin. So we always want to take safety when we're thinking about using a thermal or a heat laser like CO2, the ablative kind of laser. But with PicoSure Focus Array, we are able to safely treat brown spots on someone fair like me or someone with a darker skin tone. And also a common condition called melasma. So I don't know if there's anyone watching that has that type of skin pigmentation where it looks like a mass. It's like brown, kind of patchy. Sometimes there's little white spots in it. But PicoSure also is great with treating that. It is low downtime. So when you leave our office, you'll be a little bit pink, but that's it. You can go about your day. You want to wear a hat, and we can put a good physical block sunscreen on you, like we talked about the other day, some zinc titanium sunscreen, so you can go about and do your errands. But really, that's it. The next day, no one can tell you had anything done. You might feel a little bit of a sandpapery texture as your brown is flaking off, but that's it. You can wear your makeup and all of that. So usually we do about 3 to 5 treatments, depending on the severity of the brown. And we treat you about every month. So we would do, April, May, June, or whatever. And you'll see a great result with that. Now, brown does continue to accumulate as we age. So you'll want to treat every once in a while to keep it at bay. But that's a great option, very safe, and also no downtime. So it's an excellent choice for someone that's wanting no downtime.
Hope, can I just ask you to comment about some of the things that we see patient complaints are that they've been treated. In fact, there are patients who've been treated and they ended up with PIH, post-inflammatory hyperpigmentation. And so there's some confusion sometimes with patients whether or not it's a treatment or the treatment causes the problem, and if there are anything else to do for that or prepare for it, especially if somebody's had that experience before, how can we take the appropriate steps to manage it better for them?
Sure. So that is definitely something that we want to take into consideration when doing really any treatment on someone that is prone to having hyperpigmentation. Now you might say, how do I know if I am or not? I don't know. Well, I mean, if you ever have had a scar, a cut, a scar from acne, anything like that, if you notice that it's a little bit darker than the rest of your skin tone, you may be a little bit more prone to that post-inflammatory hyperpigmentation that Dr. Mendelsohn is talking about. Now, as I said before, we have these cells called melanocytes, and they release melanin depending on their stimulation. And when we're outside in the sun, we're going to release more melanin because that's trying to protect us from that UV radiation. So what we consider a tan is actually our skin trying to protect itself. So the sun, we want to avoid sun. If you have a chemical peel, a microneedle, anything, it doesn't matter if you're driving in your car. It doesn't matter if the sun's not blazing outside. You have to have good sunscreen to avoid any of that risk of hyperpigmentation from the sun. So that's number one. And it doesn't matter if you're darker skin tone or anything, you have to have your sunscreen on after these procedures that we'll do to treat your brown. But the other thing we can do is we can pre-medicate you. So we can use a cream that contains something called hydroquinone. And hydroquinone will suppress your body's ability to hyperstimulate these cells, creating more melanin. So it suppresses that. So we'll typically start that maybe a couple weeks before your, whatever it is, a laser, a microneedle, or any of that. And then we'll carry that through your treatment so that we're reducing the risk that way. Does that kind of cover?
Yeah, that's great. I just, I know that's, those are many patients who have problems with brown spots. And I just want to say just one other thing while we're talking about different skin types is, so we rate skin, we don't rate skin, but Fitzpatrick, a dermatologist, I think, rated skin type 1 through type 6. Type 1 is sort of like Hope, right? Reddish, blondish hair, freckles, although she's got beautiful skin, and blue eyes. But we may have very dark skin, black skin. Usually the pigment of the hair, the skin, and the pupils or the iris is very dark, and anything in between. So I'm like a type 2, type 3. I burn these days relatively easily. Karen Lynch is probably like a type 1, maybe moving to a 2, but really a type 1. And Karen Whitney, ironically, is probably in that range as well. But so we look at this Fitzpatrick type, and what that really means is the amount of melanocytes, as Hope has been talking about, that we have vary. So people with darker skin types, if they have a cat scratch them, it's more likely that they'll hyperpigment. And in those instances, those are patients whom we might pre-treat before PicoSure or IPL or peels or any skin treatments that we might offer. So darker skin types can be treated, but there may be a variation in that treatment. So I just wanted to touch on that. All right, Karen, what do you think about the next one here?
This one might go out to Karen Whitney. It says, I sweat so much during cooler months. I hate the thought of what it will be like this summer. Is there any way to stop my excessive sweating?
There is, thank goodness. It used to be that we were dependent on over-the-counter antiperspirants and deodorants. Medically, there are clinical strength and prescription strength products that you can use. The biggest downside is that they just don't cut it, they don't get the job done, and they can also be very irritating to your skin. Botox is FDA approved to treat axillary hyperhidrosis. That means excessive underarm sweating. Now, what is excessive? Well, we see patients who can be sitting comfortably watching TV and they've got sweat dripping down the sides of their chest. It impacts the clothing they wear. They're taking extra clothing to change out during the day or after work. It's really a social and functional issue. So Botox can be used, and it's a series of small injections into the armpit area. We're typically treating where the hair growth is, because it's common that armpit hair and sweat glands reside next to each other in the skin. And so a series of small injections on each side, of course, and the results surprisingly can last 6 months or longer. So that's a very easy and effective treatment that, interestingly, we can also treat palms of the hands, soles of the feet. I have patients who say, gosh, I hate meeting someone in a work setting because when I go to shake their hand, I'm all sweaty. Women can say, oh my gosh, my feet sweat so much, my shoes smell bad, my shoes don't stay on. So these are effective treatments, and really we can use it pretty much anywhere that you do perspire. I treat across the bridge of the nose, and I've treated some other regions where sweating was an issue. The other really amazing treatment option is called MiraDry. And MiraDry has been in use since, I think it was FDA approved 2011. MiraDry is an in-office treatment. It's performed by myself or one of our nursing staff. And we do use injection numbing. We've got a really nice device that makes that numbing go quickly and pretty easily for you. And once you're numb, the treatment's comfortable. We're using energy, kind of like a microwave energy, that is being absorbed by the bulk, the substance of the sweat gland, and it's heating the sweat gland. And it heats it to a point that it actually kills and destroys that sweat gland while your surrounding tissue is not damaged. The treatment, once we get started after your numbing, takes less than an hour. We do recommend that you use icing quite vigorously afterwards. I tell patients 20 minutes on, 20 minutes off for the rest of the day. We treat both armpits at once, and you will have some swelling and tenderness afterwards that can last up to a week or two. Sometimes we use a Medrol dose pack if the swelling is a little bit more than you anticipated. I've had patients tell me it feels like they have some golf balls under their arm or marbles, so it feels a little tender and lumpy. Typically, you can still go about work. A lot of times we'll do the treatment on a Friday, so you've got the weekend to chill. I don't recommend going for a swim or playing basketball right afterwards or going shopping. Go home and rest and ice. The success rate with 1 or 2 treatments, depending on the severity of your problem, is 80% or more reduction in your sweat, and there's a 90% satisfaction rate with patients for this. So it's a really nice treatment, and the incredible thing is that it is permanent. So this is life-changing. Suddenly, patients tell me they're wearing all the colors of clothing that they like. It's a very liberating treatment. So while we even treat some patients who say, it's not so much that I sweat horribly, but I seem to have really bad body odor, because the odor is an interaction of bacteria and the sweat produced. If we diminish sweating, we diminish odor. Also, sometimes it's not that the problem is horrible, but just that, hey, I don't like using aluminum chloride containing antiperspirants. I'd really rather not have to use anything because of the clothing I like to wear. And so a mild case of normal or slightly heavy underarm sweating can be treated as well. So it doesn't have to be a really severe problem for someone to take advantage of this treatment.
Karen, let me ask you just 2 questions. And first of all, what Karen was saying about patients coming in with, usually, if you suffer from hyperhidrosis, you have all black, you've always got your sweaters and cover-ups and so forth, and we really do see people with brand new wardrobes. I mean, MiraDry for hyperhidrosis under the arms, otoplasty, fixing ears, and often rhinoplasty. Those are probably the 3 top procedures that have a huge positive psychological impact. So as much as this might not be considered a cosmetic treatment the way we think about it, it really is one of these life-changing things. But let me ask you, so if it's permanent, do we need those sweat glands?
We do not. Everybody knows that sweating allows your body to cool itself. The sweat glands under your arms are a very small percentage of your body's ability to cool yourself down, so they're not necessary at all. Otherwise, we'd all sweat like crazy. It would be something everyone does.
And what about, can mirror dry be used anywhere except under the arms? Anywhere
At
else?
this point, no. They are and have been trying to develop treatment for palms and soles of feet, but at this point, no.
Okay. All right. Well, thank you very much. All right, Karen. We'll turn it over to the next question here.
Okay, so Karen, this one goes out to you too. It says, is there anything I can do to get rid of my terrible looking veins on my legs? And I'm sure with summer coming up, this is a big worry.
This is. And what I find so interesting is the definition of terrible. Because I'll have women come in and they'll say, oh gosh, I've got these spider veins that are really getting bad. And honestly, they're not bad at all. But the point is, if you see something on your legs that you don't like and it bothers you, we can fix it. So if you can see them, I can treat them. Kind of the other end of the spectrum is someone who does have large roping kinds of veins on their legs, which gets more into a medical sort of problem. So when you have a question about veins, I always ask, send a picture to me so I can give you some information and screen as to whether or not I'm a great place to start for treatment, or if we should have you screened by someone in a vascular capacity. So a general guideline is if you have veins on top of your calves or thighs as big as a pencil or your baby finger, that's a medical vein, and I can help direct you to someone who can evaluate and determine the best course of treatment. So anything smaller than that, kind of bluish, greenish, purplish veins that might be a little bit raised on the surface, especially across your shin, spider veins, which can look like either a fine line or even an ink pen marking on your legs. Sometimes it's just a pink clustering of veins that you have to look closely. Those are all amenable to treatment. And what we do is called sclerotherapy. Sclerotherapy has been used in the US for about 50 years, and we use different solutions to treat, but basically what we're doing is using a really tiny needle, injecting it right through the skin into that surface vein, and putting a solution into the vein to damage and destroy the vein. I like to use a concentrated saltwater solution. I prefer it because I get great results and no one's allergic to it. I've used that product for the last 20 years, probably injected about 3 million veins, and it works very well. Some people, and sometimes I will revert to an actual FDA approved product, which is a detergent based injectable. And sometimes we even turn that liquid into a foam to fill a vein better. So those are decisions to be made when you come into the office. But with this sclerotherapy, I'm injecting your small veins, or like the purplish veins, greenish like you have on the back of your hand. Those can be bigger at times, and those do very well with sclerotherapy on legs as well as on hands. But I inject the vein, the damage occurs as the solution flows through the vein, and then the vein looks pretty normal, maybe a little bit irritated. I treat all your veins. We put compression stockings on you, and those are an important part of the process because they take pressure off of the surface of the veins so that they can respond better. You're going to wear those anywhere from 48 hours to 2 weeks. The 2 weeks is just as much as you're able to. It's not nonstop typically. But what will happen? The next day, you'll see a little stick mark, a little bruise everywhere that my needle went in. Those last about 10 days, and so we like to avoid treatment the 2 weeks before going on vacation, a time when you need to be able to show your legs without bruising. Then it does take 4 to 6 weeks for the veins to fully respond. Due to the chemical injury of the vein, whether it's been salt water or one of the other products, the vein's going to shrivel, shrink, and shut down on itself. And that does take some time. So your bruises will go away first, but then over the next 4 to 6 weeks total, you're going to see improvement in the veins. The amount of fading you'll see will depend on your veins, their size, and overall severity. somewhere between 25 and 75% clearance. So some patients who just have smaller issues, one treatment will take care of it. Other times with the worst case scenarios, we're even doing 3 or 4 treatments spaced at least 6 weeks apart. Patients always ask, can those veins come back? They can, but really your body is making new veins. It's not the original vein reappearing. Not important to your situation. They may cause discomfort, heaviness, achiness, and if we get rid of them, then your legs are going to feel better.
Karen, so for anybody listening, first of all, Karen, I think you've injected over 3 million veins or something. I don't know, enough. I think you're finally figuring it out. But I do have a question. I know we're talking about leg veins. That was the question. But we do see many patients who come in with veins along their temple, sometimes under their eye. Is there anything that you can do for that? I know for the very fine ones we can use IPL, but for the ones that are a little bit larger, is there something that you can do? Can you inject those?
There are some veins around the orbit of the eye that are visible, and if they're large enough and I can get my needle in there, I can put some solution in there safely. You have to understand you may have bruising, you might look like you've got a black eye, you may have swelling. That doesn't always happen, but it's a risk, and sometimes it just doesn't work. What's funny is that, you know how when you look at a fish through water, the fish looks bigger than it really is. When you see these veins through your skin, they often look bigger than they really are, so they can be a really difficult target. So basically, I'll just look and tell you if I think I can hit it or not, and if you're willing to give that a try, knowing the risk for bruising and swelling. And I've mixed success with it. Sometimes it works very well, and sometimes it doesn't work. Also, if you've got some really large facial veins that the IPL is not effectively targeting, I can inject those small facial veins as well. And I can also treat, if you don't like the larger veins on the back of your hands, those can be effectively treated.
Whoa.
Does that answer your questions?
That does. Thank you very much. It sure does. Karen, how about the next one here?
So this is a pretty broad question, but it has to do with cost. And I know I get this one over the phone a lot, but how much does it cost to treat my wrinkles?
Well, you want to start with that?
It depends definitely on what area or what we're using to treat. So I'd say the most common thing we use for wrinkles is Botox, probably. And we treat in areas. So we have one area here that's called the glabella. This is what moves up and down with your brow. And then our forehead and then the crow's feet count as one area. So typically we'll start with a site is, I think, $295. But we have different rewards that are in-house, and we also accept Brilliant Distinction coupons. And then we do, I believe, have some kind of a promo. I'm not sure what, but coming up after this pandemic and shutdown is all over. But so that's kind of the cost around Botox. What do you think, Karen? What else? What are the common costs that you're?
So the other thing that we often do for wrinkles is to fill them or smooth them or add more volume to your face, which is like subtly blowing up a balloon. And the cost for fillers varies tremendously. It might be that you just have a few little lines around the upper lip, and we might use a half a syringe of Volbella, which is $390. It might be that you don't like your marionette lines, and we really need to add more volume to your cheeks to help lift. And the Voluma, which will last up to 2 years, is $940 per syringe. So when someone comes in, we like to do a global assessment. What's worrying you? Let me tell you what I see that we could help you with. And here's a treatment plan. Maybe we start with Botox, give it a couple weeks, bring you back, see how we did. Then talk about, okay, for fillers, let's start with this treatment area, move on to the other area. It's often more of a process. And I compare it sometimes to decorating a room, where you start with what's really bugging you, and then you fine tune it and accessorize and add to it. And because I know, Hope, you've seen where somebody will come in and they'll say, oh my gosh, I hate these forehead lines. So we put Botox in and those lines smooth out and they look good. And then they say, well, what's happening under here now? So it's a little bit like cleaning a room where you get the worst thing done and then you realize other things that you'd like to take care of. So it's hard to give a price on the phone, except to say that the smallest volume of a soft filler is $390, and our best lifting, longest lasting is $940. And again, we have discounts in-house that we offer, as well as brilliant distinctions, and there'll probably be some promotions coming up as we get back on our feet here.
I think an important thing is we have something for everybody, and we'll work with the budget that you have, and we'll figure something out for. So I mean, we can treat wrinkles for for anyone really.
Yeah, and most of our patients are working with a budget. We get that. We're working with you. That's why, but we're trying to be realistic too, and so that's where a treatment plan really comes into play. And I don't want, if you say, well, I hate these lines, I don't want you to just address that. I want you to know, here's what we can do for your whole face and address what's really bugging.
One thing regarding fillers, certainly cost, and I think Karen was alluding to the rewards program we have, but more than that, fillers, a little bit different from Botox. Botox, while Allergan, the company that manufactures it, says it lasts 3 months, we know generally we're seeing, even with the first-time user, 3.5 to 4.5 months pretty routinely. Most people are probably 4 to 6 months. That does vary depending on how much you're using. Once you stop using it, we're re-exercising the muscles where Botox is working, and unfortunately, they'll come back, maybe not to the same degree. With fillers, because the longevity is so great, we talked about this the other day, that easily most of these fillers last 1 to 2 years, if not longer. But here's the thing. You'll come in, we'll treat you with a conservative amount so you can see a difference, and we're kind of moving forward. And you might need to be touched up a little bit. I think Karen calls it topping it off. I think that's her phrasing. But the bottom line is once you get to your treatment where you're pleased with it, it does last a long time. So this is something that you're doing more occasionally. However, like Karen's saying, once you start with one area, sometimes you're moving to the next lower priority area. So anyway, all right, so let's go to the next one. This one looks like it's for Hope.
Yeah, so this person says, I had mild acne when I was a teenager, but now I'm in my 40s and noticing what looks like acne scars on my chin where I broke out. What should I do?
Okay. So yeah, as we age and, beyond the age of 25, really, it's kind of depressing, but our collagen just slowly starts depleting throughout the years. And what we might not have noticed as a bit of an injury from an acne scar when we're 15, by the time we're in our 40s, it starts to show as more of like a divot. So what we need to do is re-stimulate some collagen. We need to trick your skin into repairing itself. And so an at-home skincare routine is important. Some kind of medical grade products that we can get you on a regimen that's going to help stimulate collagen at home, antioxidants, retin-A's, and then also in the office, we'll want to do some procedures, and depending on the amount of downtime you have and the appearance of your scar, we can do different things like microneedling. That's a common procedure for acne scarring. The repeated little tiny injuries that we get in that area, or sometimes we'll just treat the full face while we're at it, but that stimulates collagen. And so after 3-4 treatments, we really start to see that big difference where the scar is starting to fill up because that collagen is being replaced underneath it. So that's a great treatment. We can add platelet-rich plasma to that. So that's where we draw your blood, we spin it, we concentrate the platelets. Those platelets send a boost of collagen-generating factors we can just target one area. We can do that on the full face. So that's another popular treatment option for acne scarring and collagen depletion. We can do lasers if we need to do that. So those are a few different options. Now, when it comes to scarring in general, There are sometimes other elements to a scar that we also need to consider treating, like the redness and the pigmentation. So we'll use a combination of modalities sometimes to make the best difference that we can in the skin. But that's kind of why you're seeing that in your 40s now, as opposed to when you were a teenager and had the breakouts, because our collagen is it's depleting and we got to stimulate it back up.
Alrighty, thank you. How about the next one here? We've got just a couple left here.
So this one I think is might be good for Hope too. It says, I have a brown spot, but it feels like a bump. I don't like the look of it. How would I have this removed?
So that's actually a very simple process. When it comes to bumps, Dr. Mendelsohn likes to call it my lumps and bumps, but I'll go over some of the more common ones and show photos if we can on Friday, I think. But some common bumps are moles, so brown mole, skin-colored mole, something called seborrheic keratoses. These are these bumps or lesions that are kind of scaly feeling, really common around the hairline. Men and women tend to get those genetically, and so those are common. Sebaceous hyperplasias, where they look kind of like donuts. They're a little gross around the pore. And a lot of these, they're not going to respond to a laser. They're not going to respond to certain treatments. So really, we do have to remove them with either a shave excision or full thickness surgical excision. So the shave excision, it's an in-office, it's very simple, quick procedure. What we do, we take a little bit of lidocaine and epinephrine mixture. We do one little poke underneath the mole. It's a tiny poke. It's quick. It numbs immediately. That numbing will work really fast. The epinephrine takes a few minutes to soak in. The epinephrine is what constricts our blood vessels, so we're not bleeding during the procedure. But I just take a flat instrument and we shave that mole, that bump, right off, and it's just flat surface to the rest of your skin. We put a little ointment and a Band-Aid, and that heals really in a few days. So, and then your bump's gone, and that's it. It's super easy. The other option, because sometimes a bump will go deeper, so something like a cyst or a blue nevus, a deeper mole, where we actually have to excise the full thickness of the skin, which really it's not deep, it's just a few millimeters. And so we'll take out that little area with the same methods. We're going to do lidocaine mixed with epinephrine, so all you feel is that first little tiny poke. We cut out that little segment of skin, and then we put a few sutures to keep it nice and close together. So those sutures usually come out in about a week, and then you're good to go, and then your lump is gone. So both great options. It depends on the lesion we're looking at, so we can go over with you which option's better for you, but that's the best way to get rid of your lumps and bumps.
Oh, thank you. That's good. I think the next question might have to do for Karen, and it has to do with tattoos. And this woman wrote in, she said, I have a tattoo that I regret. Can it be treated if I have dark or tan skin?
Okay. So when we talk about tattoos, basically larger particles of ink are being placed into the dermis or under the surface of the skin. So the epidermis, the surface, keeps your tattoo in place, and these particles are large enough that your body doesn't absorb or dissolve or try to carry them away. So we've used tattoo removal through the years to try to break that ink into smaller pieces so your body can carry it away. Q-switch lasers have been around for about 25 years. They are quite common, and they work on the basis that when the light hits the ink, there's a thermal or heat breakup of that ink into pieces. The problem with that was that it was very painful, often caused some bleeding afterwards, but the risk for scarring of the skin and pigment changes were pretty high, and it was a very slow process. It just didn't work that well, and was better on black inks, not so good on blues and greens. About 7 years ago, the pico-short lasers were introduced, and I've been fortunate to work with the pico-short laser for the last 6 years.
Hey, Karen.
It's not a miracle laser. It still takes multiple treatments to break up that ink, but instead of it being thermal, the
Karen.
impact of the light, which is it pulses 1,000,000,000,000 times a second, is a mechanical breakdown of the ink. So it's more like a rock hitting your ink instead of a match. And people will try to think about, well, how does that work? But think of when you would roll up a towel and whip it at somebody's butt. As a kid, the faster that towel hits, the more impact you feel. So it's the speed of the energy has more of a mechanical impact. That's good news because it means that there's less likely to be disruption of the skin surface, less risk for scarring, less risk for pigment change. Having said that, the light cannot differentiate between pigment and your natural coloring. So when we're talking about darker skin types, there is always a risk of some loss of your normal pigment and also some surface textural change. Much less risk than if you were receiving a Q-switch laser, but still a possibility. When you're tanned, we like to hold off on doing your tattoo removal just because you're more likely to break up some of your own pigment. So we tend
Karen.
to hold off on doing tattoo removal on exposed areas during summer months and while you actively have a tan. And if your skin is naturally darker, we use a more gradual advancement of the settings to be sure that we're staying within a safer zone. If you do have some loss of pigment, often your body will repigment in. Think of if you were a kid or even as a teenager or adult skinning your knee. All of our knee skins didn't leave us white, they repigmented. But I often have seen patients who have a lot of background tan, maybe somebody who wears a short sleeve shirt and then they've got an armband, so that their arm is always tan. And as we get rid of that tattoo, if it's a dark or more difficult to remove, we see.
Karen, I'm not sure if you can hear us.
Yeah?
Okay, we've lost your audio a little bit.
Oh, you lost me?
We did, but then so just
Backtrack?
But you're back. Well, that's okay. Let's do this. I think we did get enough of that. Let's go to the last question, and we'll see what we can do here. You were in and out a little bit, but that's okay. You're back.
Okay.
So go ahead, Karen Lynch.
Yeah, so this question said, I heard that Botox can be used for migraine headaches. Is that really a good use for Botox?
Oh, you want to go first?
Oh, that's okay, Karen. You go ahead.
Okay, I love using Botox for headaches because the patients who get results really love me. And I know you've seen this too, Hope. And often it's someone who says, well, I feel like I have a lot of tension in the center of my forehead or my temples when I get my migraine headaches. And so it seems that their muscle tension, looking at a computer screen, focusing, engaging throughout the day, that muscle tension seems to be triggering their headaches. So sometimes treating the frown or glabella or forehead lines or crow's feet where there's muscle tension in the eyes, by relaxing those muscles, the frequency and severity of headaches can be greatly diminished. I also have patients who know where their trigger points are. And what I mean by that is somebody will come back and they'll say, oh my gosh, this area of my neck hurts so badly when I'm getting a migraine headache. And they'll show me, and it's the tendons in the back of your neck and the muscles, and you can literally put some Botox right into those areas. It might be the temporal muscle, it might be the frontalis coming back up into the hairline, and it might be back along the occipital muscles. But we can put Botox there, relax those muscles, and really reduce the severity and incidence of migraine headaches. Some patients have such severe recurrent headaches, several a week, that they'll see a neurologist for migraine headache treatment. In those cases, up to 200 units of Botox are being used. I think that's the right number, but 31 different injection sites into all the trigger points. But we find with the patients we're treating that if headaches are more in a normal category, that we get really nice results with relaxing the muscles. and it'll last 3 to 4 months, and patients will come back. I know you hear this, Hope. Oh, they're not worried about their lines. They're just saying, oh my gosh, I had a headache yesterday. It's time for my Botox.
And more often than not, I find that I just listen to the patient and they can point out, like you said, where their trigger points are. We were going on the upper back the other day, and the back of the neck is very common, and then up in the scalp, the hairline. But yeah, typically people know exactly right where that area is that's bothering them, and the Botox will provide, pretty quick relief. Mm-hmm. Also, those tension headaches that are, right in between the brows there. I have a lot of patients that get a lot of relief from that as well. So, mm-hmm. Very good treatment option.
Well, great.
Do we have any more questions?
I think that's about it. I think Dr. Mendelsohn wants to come back on and talk about how to do a virtual consultation, but other than that, I think we may have wrapped it up.
Great.
Oh, okay, Dr. Mendelsohn can't come back, so we're going to sign off for now. But thank you for joining us, and we'll see you tomorrow. I think we're going to be talking about the advanced facelift.
Awesome. Bye, guys.
Thank you.